Oftentimes, when individuals suffer a knee injury, they are referred to a physical therapist. When they go to physical therapists, the two key things that we are looking to do is reduce pain and symptoms and improve their overall function. When we talk about pain management, this can come in a variety of fashion. So it may come in an educational form, where your physical therapist informs you of the different things that are contributing to your pain levels and how you can modify activities and your daily routine to prevent yourself from putting yourself in situations where you're exacerbating the issue. They may also use different modalities such as ice, heat, electrical stimulation, or compression garments to help manage pain, inflammation, and swelling. A large part of physical therapy is going to be the active component of your rehab sessions. And this is where during your initial evaluation, they are going to look at your range of motion, your balance, your strength, how you move or your coordination, and they're going to come together with a plan of care that addresses any impairments or deficits that they see in each one of those categories. This is where there's some variability from session to session, and your physical therapist will create a customized and individualized plan based off your own specific needs. A highlight of physical therapy is promoting independence and self-efficacy for a patient. What your physical therapist will try to do for you is teach you strategies and ways that you can mimic things that you are learning in your physical therapy sessions and performing them as part of a home exercise program or doing things on your own time outside of PT to facilitate and accelerate your recovery and get you back to 100% as soon as possible. One of my favorite exercises to do if you find yourself with a knee injury that's limiting your ability to bend the knee and your quadricep muscle is tight is a kneeling quad stretch. And with this stretch, you're going to be in a half kneeling position. You'll have one foot out in front of you with it flat on the ground. Your knee will be on a soft surface or a pad, and your back foot will be elevated. From this position, you want to try to sit as tall as you can, and if somebody's looking from the side, they should see a straight line from your shoulder through your hip all the way down to your knee. Hold this twice for a count of 30 seconds, and you should be at an intensity that allows you to carry on a conversation, breathe regularly, and feel a strong but comfortable stretch through the front part of your thigh. Now, if we're having issues with flexibility in the opposite direction, so fully straightening the leg, or we just have tight hamstrings as a result from a knee injury, one of my favorite activities to do is an active hamstring stretch. And some people will call these hammy kicks, other people will call this hamstring flossing, but with this you are going to lie on your back, and it can be on the ground, it can be on a bed or a comfortable surface. You're going to have one leg out straight, the other leg you will hold the back of the thigh with both hands, and starting with a bent leg, you will attempt to straighten the leg as much as you can. If you can straighten it out, great. If you can't, don't worry about it. Just take whatever your leg is giving you. It will get better with time and repetition. And with this, doing a set of 5 to 10 repetitions is ideal, and repeating that for 2 sets on each side. Transitioning from mobility to strength training, an easy and effective bodyweight strength activity for your hamstrings and the back of the knee or the back of the leg are single leg bridges. These can be done lying on the ground, and you can have your foot directly on the ground, or if you want to go through a little bit larger range of motion and have a little bit more of a challenge, you can actually put your foot up on something such as a box, a bench, or a chair. You can have your arms on the ground to help with balance, or you can put them across your shoulders to challenge your balance and your core stability a little bit more. And you will dig your heel into the ground and try to elevate your hips off of the ground into a bridge. With this, try to perform 8 to 12 reps for 2 to 3 sets on each side. Now, while the single leg bridges focus on the back side of the leg, if we want to target muscles on the front side of the leg, the easiest way to do that is to use a leg extension machine. But if we want to look at something that's going to target the front side of the leg, but also work the whole lower body, a split squat is a great option and a great choice for this. In a split squat, you'll have one foot in front with that foot flat on the ground, the other foot behind you, and your heel will be elevated off the ground. Try to keep your body as upright as possible, meaning we are not leaning forward, and you're going to lower yourself down until your back knee touches the ground and then rise back up. With this, perform 8 to 12 reps for 2 to 3 sets on each side. If you find that your body weight is not challenging, you can add additional weight through holding dumbbells, kettlebells, or a medicine ball to make it a little bit more challenging. This is also going to have a stability component to it. So if you find yourself a little bit shaky or a little bit wobbly, try slowing down and reduce the weight if needed. And the final exercise that I would give that works a little bit more on balance and stability is a single leg RDL. For this activity, you're going to balance on one leg, and on that leg you will have your knee slightly bent. So we don't want to lock the knee out, we want to have a slight bend to it, but that position is going to stay consistent throughout the rest of the motion. From this position, keep your back flat, and you're going to hinge or bend at the waist and reach down for the ground with your hand. With this, you want to try to touch the ground and come back up to a vertical position without putting your other foot down for balance. This may be a challenge in and of itself, just using your body weight. If you are doing that and it is easy, you can add a weight to provide a little bit more resistance. This will train primarily the muscles on the back of the leg, sometimes referred to as the posterior chain. Perform 2 to 3 sets of 8 to 12 reps. Now, there's an infinite variety of exercises that you can do when it comes to mobility, flexibility, strength, balance, coordination. These are just a few common examples that you'll see performed in a physical therapy regimen. As with all, make sure that you are doing this under the guidance and under the supervision of somebody who has seen you move and has provided you with activities consistent with your abilities and tolerance level. In this video, we tackled the concept of knee pain, the anatomy associated with the knee, different types of common injuries that can happen and contribute to knee pain, what a physical therapy evaluation may look like, and what some common rehab exercises are. If you have any specific questions, throw them in the comments and we'll provide an answer for you. If you have suffered from knee pain yourself, feel free to share about your journey, your experiences. We would love to hear from you. I'm Dr. Zach Baker, Chief Clinical Officer at Rehab to Perform. Stay tuned for our next video.